Everyone is talking about interdisciplinary work, but talking about and realizing is a complete different sheet. And realizing interdisciplinary work means you accept that you have a higher goal. Here, within that interdisciplinary consortium, it was clear to everyone the main goal is to create something which is of help for colleagues around the world and fast, so that they can act and handle. Of course, this is just one aspect which you need to get through such a crisis. Another one is, of course, testing physicians, patients, nurses, and non-medical healthcare workers either. And we will show that in another 2 papers, which they will come out within the next 2-3 weeks, something like that. A lot of surgeons worldwide were very, very unhappy with the available guidelines in terms of COVID-19, how you should handle that. So we discussed it, and the main point which was coming out was that a lot of documents had been produced by a lot of societies or colleagues. Some societies even did not provide anything, however, and it came out to the point that a really practical, clinical, approachable guidance is missing. We discussed that with colleagues in universities, in academia, in teaching hospitals, and also, and that is our duty, also in science, with small hospitals, very small hospitals. We said, okay, we have to do something because this can be a horrible situation for a hospital or for colleagues, for nurses, for healthcare workers. So we went a complete different way. Our aim was really to help surgeons worldwide, whether you are working in Spain, Italy, Germany, or in a third world country, independent of that. That was our aim. Of course, you can create a bunch of papers, of dozens and hundreds of guidelines. This is not what you clinically need. You have to divide here and to differentiate clearly what is science on the one hand side and what is practical and has to be approachable by everyone around the world. So you have to make it easy. You never can use a classification in the world where you have 6 or 7 or 8 variables. This is nonsense. This will not work. So you have to use a classification with 3, maximum 4 variables, as we did, and the underlying PPE box. So we have to wait. It's amazing that this paper had been, I think, downloaded within a couple of websites within 10 days, 7,000 or 8,000 times. So this says it all. I never experienced something like that. So again, also this one is amazing. A unique way of communication to create it by wonderful individuals worldwide who all said priority 1 is only to create that guidance, nothing else. Usually if you work together, people demand, okay, send me that document, send me that document. And that is a bureaucratic way. We are used to it. So some of us came to the point and said, hey, we have to be here very much faster. This is not the way we can handle that. So we said, okay, we use a social medium and we demand from everyone that we use one strategy to concentrate on the main graph, which is in the publication later on, figure number 3. And invited a lot of people and surgeons and scientists from the world. At the end, we had been 35, and a couple did not accept our way. And we said, okay, but this is our way, we want to be fast. So they were out afterwards. And a lot of people answered late, a week or 2 weeks later, and we already had been done, which shows it was the right way. So what we did is resend all the kind of modifications in a really online track change mode. And a couple of us from INCOR, from the International Consortium of Research Excellence of the TBA, stored and collected the data for it and modified it for writing the paper, because you need, of course, the scientific content included. So we did that, and it was amazing. And the scientists from Australia, Austria, Brazil, Ecuador, Germany, Guatemala, Iran, Italy, Philippines, Poland, Portugal, Spain, Turkey, and the USA, to get that done within 5 days, that was absolutely amazing. Of course, we were working day and night. We just slept about 1 hour per night. We also had been lucky to receive actual data from colleagues from Israel, from Hadassah, which were in press but were not officially released, by means they had been under embargo. And they directly said, no problem, you get that confidentially. We all learned something, and we all did something, and that was together. And now you see what the science is about.